We get to address another poisoning, and this is poisoning with benzodiazepines. Poisoning with benzodiazepines. So I'm trying to look at what are examples of benzodiazepines that could easily poison someone and what would be the effects. Okay, so common benzodiazepine. This was withdrawal symptoms, but usually due to poisoning though, because you have been poisoned before and you want to stop. You understand? So benzodiazepine poisoning, also known as overdose, it typically causes central nervous system depression. So you have drowsiness, you have confusion to coma, you have respiratory failure. So what are the overview of benzodiazepine poisons? So it's just ingestion of benzodiazepine in amounts that are greater than what was recommended for that particular disease. So common benzodiazepines that could easily poison you. We have drugs like diazepam, we have lorazepam, we have alprazolam, we have clonazepam, we have midazolam. Okay. And most of the times, if you are also using the drug, that's a benzodiazepine, and you are using another drug, it could be alcohol, it could be opioids, or maybe the person is elderly. So clinical features include, it's mild to moderate though. So confusion, drowsiness, dizziness. The speech is slurred and impaired coordination. Hypotonia, nystagmus. Okay, hypotonia, that's muscle weakness, nystagmus. Amnesia, impaired judgment. So when it's severe, the person can go into coma, respiratory depression, hypotonia, aspiration, pneumonia. It could even lead to death, but it's rare. So this is diazepam. This is lorazepam. So diagnosis is you are trying to ask questions around and see that the person has been exposed to benzodiazepine recently, and you are trying to do physical examination to see which systems have been affected and to what range. That you are doing all those laboratory tests, toxicology screening, blood gases test, electrolyte test, and the rest of it. So you manage it using supportive care, airway protection and oxygen support. You monitor the vital signs, intravenous fluid for hypotension, then activated charcoal sometimes if you want the person to vomit. The specific antidote is you have the Flumazenil, which is a benzodiazepine receptor antagonist. So if you give the Flumazenil, it's kind of like counter the benzodiazepine from attaching to its receptor. So I think that's what we got for this.